So when I left off talking about the rumen, the other thing when we compare digestive systems, the monogastric stomach is glandular, and if it's a gland and it's secreting something, one of the things it secretes is stomach acid, which obviously sets up that acidic pH. The stomach can get as low as 2.0, which is extremely, base is 7.4, so 2.0 is pretty acidic. The first three parts of the ruminant stomach, reticulum, rumen, omasum, because of this ecosystem, you've got bacteria, protozoa, fungi, they are taking the place of stomach acid. There's not stomach acid. That pH, their pH is like upwards of 6 or 7.6, 7.8. It's very alkaline. And really anytime you have a species that's a plant-based diet, they're going to be more towards alkaline. But you also, if there was an acidic environment, it would kill off their ecosystem. Now, when we get to, that's okay, Cassidy, that's important. When you get to the last portion, which is the abomasum, and that's right before the contents move into the small intestine, that portion of their stomach is glandular and it will have an acidic pH. But the difference is in the cow, when stuff moves through, the abomasum isn't for storage. It kind of is just like a passing through chamber. Think of it that way. Even though it does have, all of the foodstuffs should already be broken down and, partially digested in the first three parts of the stomach. So they don't need necessarily the acidic pH like, we or dogs or cats do. So it really just kind of passes through, but it is glandular. But I do want you to know, to be able to compare the pH of the different stomachs. That's kind of a key difference. So I just didn't get to bring that up at the end of class yesterday. So now that we've talked about the stomachs, all of the stomachs are going to connect to the small intestine. And the small intestine is the first part of the kind of like the intestines and the beginning of the end of the digestive tract, the beginning of the end, I should say. Now, chyme is the product that leaves the stomach and enters the small intestine. That's this partially digested foodstuffs is called chyme. And it's a semi-liquid form, so it's not, completely liquid, it's not completely solid. Now, you do need to know the order on the three parts. So the order is the duodenum, the jejunum, and the ileum. And actually, I like to come up with funny ways to remember things, but one of my students in a previous class said, hey, this is how I remember it. DJ ileum. DJ, and I used to make a DJ funny thing, and then students would laugh, but DJ ileum is duodenum, jejunum, ileum. So the duodenum is the very first part of the small intestine. Now, they have, and I have to admit, during dissection, I can find the duodenum, and we will find the end. We will find the ileum, where it attaches to the colon. Now, the transition between the duodenum and the jejunum is a little bit harder to determine because the intestines begin to coil, and that's a little more difficult. But the duodenum receives the chyme, so that's the first place, goes from the stomach. The jejunum is actually the longest part, and this is where the majority of chemical digestion and absorption. If you remember from nutrition, the majority of absorption of nutrients happens in the small intestine. So this is where a lot of activity is going to take place. And then the ileum is the last part. There's pyre patches, which are part of the immune system. But what I really want you to know is the ileum is the last part of the small intestine. Now, the ileum is going to attach to the large intestine, but it depends where it attaches on the species. And this is important to know for the test. In the horse, the ileum is going to connect to something called the cecum. So the cecum is part of the large intestine. And in the horse, the cecum is a very large component. And the cecum in a horse is where they are going to break down their grains, you know, because a ruminant eats like what a cow does. I'm sorry, this is a student taking a test. Hold on one second. Hello? Okay, we're re-recording. Okay, so in the horse, they are dependent on their cecum for digestion of the same food that they eat like a cow. So a cow is gonna, you know, which are, you know, they're called ruminants. A horse is a hindgut fermenter, and the cecum is that part of the hindgut. The hindgut is referring to the large intestine, specifically the cecum. Now, a horse cecum is extremely large. Now, sometimes I ask that on a test and I say, why is the cecum large? And someone says, because it's a horse. Well, I understand a horse cecum is going to be big because a horse is big, but it's big because it is their fermentation chamber. It's their storage, or sorry, their digestion. They're reliant on their cecum to digest. Now, in a dog and a cat and in people, it's going to go from the ileum directly to the colon. In people and dogs and cats, the cecum in a dog and a cat, it looks like a little, it's kind of like a little bump or a little pouch, like off of the intestine. So stuff doesn't really pass through it. And in people, if someone has an appendicitis, if you've ever heard of someone having their appendix removed or appendicitis, that is usually affecting that part. That's the cecum. And in people, they usually call it the appendix. And again, you can have it removed because it doesn't serve really a digestive function. It sometimes gets inflamed and can get infected and cause problems. So in dogs and cats, what we say is the cecum is inconspicuous, meaning it pretty much goes ileum to colon. They do not have a prominent cecum. And then in horse and cattle and pigs, it's going to go ileum, cecum, colon, but stuff just passes through the cecum. Stuff is not really, they don't really, in pigs and cows, they don't use their ileum like a horse, but it does pass through. So I do want you to know, at least for the cow, the horse, the cow, and the dog, where does the ileum connect to? So again, in a horse, it's ileum cecum. In a dog, it's ileum colon. And in a cow, it's ileum cecum, except the cecum does not play that huge, because they are not a hindgut fermenter. Now, the structure, if you zoom in really close, the intestinal lining is not flat. If you guys remember, I talked about villi. Now, a villus is a surface adaptation, kind of like this bump. Now, this is called, so this is a villi, which is this one lump, and on the edge, you have microvilli, which is a brush border. So on the surface of the, now it's actually interesting, if you cut open the intestine, or sometimes if you get to help with like a foreign body and you cut open the intestine, if you look at the inside, it almost looks fuzzy. It's not, you know, the outside of the intestine is mucosa or is serosa, and it's very smooth and kind of shiny. If you open the inside, it almost looks fuzzy. And that's actually these tiny little villi. And what happens, maybe I can do this. This always, let's see if this, I know how much you guys, whoop, that's not working. Oh, there is maybe, oops, except that needs to go. Okay, I'm gonna try and draw something. Let's see how this goes. Okay. Okay, this is missed my drawing. This is chyme, okay? And when it moves through the intestine, this is a villi, okay? And on the edge, it has like the brush border, okay? Now, what happens when the chyme moves through here, okay, it can move in between these villi, okay? And what that does, it increases the surface area, because if you can imagine, if the intestine were flat, you would only have that surface for absorption. But because the villi make these little divots, chyme can extend to all those surfaces. And this is where any nutrients and wastes, you know, nutrients is what we want, wastes get absorbed, and I'll talk about that later. But it's going to go in here and get absorbed. Now, inside this villi is, you know, you have blood vessels. You're going to have, you know, capillaries. You have arterial and, you know, venous capillaries, and that's going to draw in, and then it's going to continue to move through. Now, what's interesting, let's see if I can do, let me try. So see, every time I try to do something, let's do, let's see if I can get back to normal. Okay, well, this recording is going to be really fun. Sorry. Okay, sorry if that caused any problems. Okay, so basically what I was drawing was, this is just showing one. Now, inside every villi, you're going to have capillary, you know, arterial, venous, and then you're going to have this white vessel, which is a lymphatic vessel, because the lymphatic vessels are where the fat gets absorbed. So any fat in the diet, I mean, some of it goes in the blood, but a majority of it is going to go into the lymphatics. And that's where we're going to absorb everything. Now, intestinal crypts are kind of like the in-between. I was pointing with the little arrow, like food can go in between. So in between each villi, which is, you know, if you think about a crypt, like a, you know, where you put like a coffin or something, but that crypt, it's talking about the in-between each of those villi. So one of these is a villus. The microvilli is the brush border. Now, what happens sometimes when animals have, if you've ever heard of inflammatory bowel disease in cats, sometimes dogs can get the issue, but when an animal has chronic diarrhea, and sometimes inflammation in the intestine will cause those villi to swell together. Well, then what happens is it's not able to, you know, what the animal eats does not get absorbed. You only have the surface because the villi swell. And then what happens is, the reason it's diarrhea is it moves through the small intestine very quickly, and it doesn't absorb much water, hence diarrhea. Now, what happens when animals have chronic diarrhea, like animals with inflammatory bowel, is they tend to lose weight. They tend to, you know, they get skinny, and they're also usually very hungry. And, you know, so the problem is, you know, when owners are like, my animal's eating, except they're losing weight. And this, you know, and if they're having diarrhea, you know, it's because the nutrients are not getting absorbed. So the animal doesn't feel satiated. They don't feel like their appetite is, you know, quenched, or, you know, they're not satisfied with their meal. And then it's moving through so fast that they're not absorbing, so they're not gaining weight. And, you know, we can put them on anti-inflammatories, which then opens up those intestines. We usually put them on a bland diet, something very digestible, and help firm up the stool. So there's a way to treat it. But if you understand the anatomy of the intestine, you can understand if we had inflammation there, it can interfere with absorption. And that's kind of the big consequence of animals with IBD. And it's usually fairly foul smell. I mean, not that diarrhea smells good, but there's some that smell worse than others. Well, if they're not absorbing like the fat and food, and it tends to have a worse odor, that's possible. If you look inside the lacteals, which are those, they're called lymphatic capillaries, but they're going to, anything that's an absorbed lipid or something that's fat soluble gets collected in these lacteals, and then it's going to empty into a thoracic duct and into the vena cava. So a lot of the fat, the lipid soluble materials are carried through the lymphatic system. Some of that does get deposited again into the vena cava because, some of the blood does have to carry some of these lipid soluble materials, but a lot of it is going to be carried within the lymphatic system. And then the capillaries are going to collect nutrients. Wastes end up getting, absorbed too, but then all of the blood, what I want you to understand here, all of the blood that is collected from the small intestine that gets absorbed is going to go to the liver first before it enters general circulation. Since we've talked about blood flow, let me explain what I'm talking about. Now, when blood goes to the intestine, it goes to the mesenteric artery. It branches off the aorta. The mesenteric artery is the blood flow to the intestine. And then oxygen is dropped off and nutrients. And then the blood that is picked up from the intestines, the body realizes that the intestines are picking up nutrients, but they're also potentially picking up wastes and toxins from the food. So what happens is the mesenteric veins or venules are all going to empty into something called the portal vein. The portal vein is going to go into the liver, and then the liver is going to process that blood. And then the hepatic, after the blood is processed, the liver is going to get rid of any like waste materials, the nutrients that can be absorbed in the liver, but then that blood is going to go out the hepatic vein to the vena cava. So I want you guys to realize, normally I would say mesenteric vein, vena cava, heart, but intestinal blood flow has to go to the liver first to be processed because it's kind of a protective mechanism. If it goes to the liver is trying to filter out anything that would potentially be dangerous that it doesn't want to go back into general circulation. So it's kind of like a processing plant. The liver can take some nutrients, it'll take those wastes, and I'll talk about that pathway, but then the good blood, after it's been filtered, is going to go through a hepatic vein into the vena cava back to the heart. So blood, I know it sounds like I'm beating this drum, but I want you to understand, is all intestinal blood has to go to the liver before it goes back to the heart. And I kind of joke, I'm going to talk about the liver here in just a bit, but I kind of joke that the liver is almost like the body's Brita filter. I talk about the kidney a little bit like that, but it's basically like a big filter, like a HEPA, hepatitis, HEPA liver, HEPA filter. The blood gets filtered to the liver, then back into circulation. Now, within the duodenum, normally digestive enzymes, remember I talked about, are secreted in the stomach, or they can be secreted into the intestine. But there are a few secretions that can be secreted into the duodenum, but they influence the stomach. So if you remember cholecystokinin, it inhibits gastric emptying, inhibit or slows it down. This is usually because the chyme needs some more bicarbonate and more digestive enzymes. Now, remember, bicarb is a buffer. When stuff comes from the stomach, it can be highly acidic. If the chyme hits the duodenum and it's like too acidic, then what cholecystokinin will do will cause a secretion of bicarb to help buffer that so it's not so acidic. Also, if now pancreatic enzymes will help digest the carbs, so if there's, and will help digest fat. So if it's high in fat and if it's highly acidic, the duodenum is basically telling the stomach, can you slow down? Like stop emptying because I need more time to digest. So if there is a high amino acid, which is if it's a diet that's high in protein, if it's high in fat, or if it's very acidic, that is the stimulus for cholecystokinin. Okay, so if I was to ask you on a test, what is the stimulus for cholecystokinin to be released? Well, number one, what does it do? It slows down the stomach emptying. Why would it be secreted? If for some reason the chyme that comes from the stomach to the duodenum, if it's high in amino acids, which is basically protein, high in fatty acids, or highly acidic. Now, secretin will actually get secreted in the duodenum, but it influences the stomach and it will decrease hydrochloric acid production and increase bicarbonate secretion. So again, why would we decrease hydrochloric acid? Maybe the chyme is highly acidic. Why would we need more bicarb? Bicarb will buffer acidity. So again, if a highly acid, if the chyme is really acidic, it's almost like the duodenum is going, ow, like, oh my gosh, like I gotta buffer this because, the duodenum, you don't really want a lot of that acid from the stomach to affect the small intestine. So it's kind of like giving feedback to the stomach. It's like, slow down. I need more time to digest. This is really acidic. It's really fatty. It's a lot of protein. The problem is the stomach is just going to keep like pumping stuff out. So I want you to know these two things are secreted in the duodenum, except they affect the stomach. So if you have any questions about that, let me know. Definitely can kind of help explain that. Okay. Now, moving on to the pancreas. Now, the pancreas is technically an endocrine organ, so it's not a digestive organ. It's part of the endocrine system because it is a gland. And I've mentioned this before, the difference between an exocrine gland and an endocrine gland. A pancreas is both. The endocrine pancreas really contains the pancreatic islets. And I'm going to talk about the cells. The exocrine pancreas, which is the groups of acini, but the exocrine pancreas is for digestive function. Now, in this picture, this is important because during dissection, I'm going to have everybody point me out. I'm going to say, find me the pancreas. You have to show me. This is the esophagus. You're watching me. This is your stomach. And then this is the duodenum. The pancreas lives around the bend of the stomach and around the duodenum. Now, the interesting thing is the pancreas is like a flat, almost a completely flat organ. It looks kind of, I know this sounds weird, this looks like flat scrambled eggs to me. I don't know how else to explain it. It can kind of be like a beigey, pinkish color. But where you find it is, I always tell the students, the easy way to find it is find your stomach and grab your duodenum and flip it over because it's easier to see it on the ventral side. And then you'll see, normally you have this mesentery, which is like the clear cellophane stuff. And then you'll see the organ laying up against the duodenum. This little green tube right here, this is actually the bile duct. It's cut off in this picture, but I will talk about that. But you have esophagus, stomach, pancreas, and this is the duodenum. And this is where you find the pancreas. Again, flat, it's right up against the bend of the duodenum. Now, The endocrine portion, which are the pancreatic islets, there's different cells, but the two to know, the beta cells are responsible for secreting insulin, and alpha cells are going to produce glucagon. Now, endocrine, if you remember, means to secrete within. The endocrine pancreas secretes these substances, insulin and glucagon, into the bloodstream. They do not need a duct. It goes directly into the blood. Now, what do? Insulin decreases blood glucose. When an animal eats a meal and glucose is, when the meal is broken down and glucose is floating in the bloodstream, insulin basically takes the glucose and puts it in cells. A good analogy, I don't think you guys got to meet Mrs. Sipes, but maybe Gillis has sometimes used this analogy, is say you go to a restaurant and you order a meal. Okay, your meal is in the kitchen. Now I'm at a table. How am I going to get my food? I'm going to have a server. And a server is going to bring the meal from the kitchen to my table. I'm the cell. Okay, the server is insulin. So the way that I access my meal or access my glucose is the server has to bring it to my table. When an animal eats, glucose is floating in the blood. The cells need the glucose, but insulin is going to take the glucose and put it in the cells. Hence, if an animal is diabetic, if they are not producing enough insulin, what happens is an animal eats, glucose is released, except it hangs out in the bloodstream, and the cells can't get it. That's why animals that are diabetic are hyperglycemic, or they have elevated blood glucose. It's because the insulin isn't taking it and putting it in the cells. Now, the opposite is true of glucagon. Say it's at night, the animal's not eating, the body needs some glucose. The body always stores leftover glucose. It's kind of like if you go to a restaurant, you don't eat all your food, you stick it in the fridge like leftovers. If an animal doesn't use all their glucose, which they're not always going to, then the glucose is going to be stored. But the way for the animal to access stored glucose is the alpha cells will release glucagon. Glucagon will raise blood glucose by accessing stored glucose. So in the event of an animal not eating, it's not like they can't get glucose, then glucagon will kind of mobilize stored glucose. So I want you to know, insulin and glucagon are the opposite of each other. Insulin lowers blood glucose and glucagon raises blood glucose, and both are produced by the endocrine pancreas, which secretes within. Now, the exocrine portion, and I've told you an exocrine gland has to possess a duct. The exocrine pancreas has a duct or a tube, and it is going to converge and connect into the duodenum. So exocrine pancreatic enzymes are going to be secreted into the duodenum, and they are going to help digest the meal. Now, the other thing that the exocrine pancreas does is it secretes bicarbonate to help buffer and digestive enzymes. Now, normally, these are secreted when there is when there is stimulus, like the chyme is going to move to the duodenum, there is a stimulus. Sometimes these also are released in anticipation of a meal. So again, there's that cephalic phase and somewhat gastric phase. But let me talk about a few of the enzymes that are important. So the exocrine pancreas produces lipase and amylase. Those are the two that are very important. If you guys work in a clinic or you've ever had blood drawn on your animal, part of a chemistry panel will measure amylase and lipase. And those are two of the values. If we're worried about pancreatitis, and animals, pancreatitis can be very painful. They can be very critical. Sometimes animals get into like a bunch of fat, or they get into something. A lot of times this happens if the owners give their dog something too rich, something very fatty, a bunch of whipped cream or fat from the steak or pork. Like I never give my dogs ham. I stay away from pork because it's a little bit more fatty. Sometimes it can flare the pancreas but you're going to look at amylase and lipase, and those are pancreatic markers. Now, something that is very important is there's also proenzymes. Now, remember, these are proteolytic enzymes, so they're going to help break down the protein component of a meal. Trypsinogen and chymotrypsinogen are the most important. And usually what happens is now remember, anytime you see gen on the end, it's an inactive form. So what happens is when the chyme hits the duodenum, trypsinogen is going to be released, and then CCK is released, and that's going to activate trypsinogen, and its active form is trypsin. So let me type something here in the chat that I want you guys to put in your notes. Okay, there is a condition that I want to bring up called exocrine pancreatic insufficiency, or it's commonly abbreviated EPI. So if a dog is suffering from EPI, then what happens is their exocrine pancreas is not effectively secreting these proteolytic enzymes. Now, I had a glaring case of this, and this was so long ago, but I don't forget this case, and it can be genetic in German Shepherds. Yes, that's what I'm going to talk about, Morgan. So this German Shepherd came in, and not make this up, those lovely German Shepherds, but this German Shepherd came in and it was like skin and bones, spasomaniac. And the owner's like, this dog just has diarrhea all the time. She's like, he eats poops, eats poops, eats poops. She's like, he's starving and he's skinny. Well, we fed the dog in the clinic. It probably wasn't even 10 minutes. I go back and the dog is like blowout diarrhea and foul, foul, foul. When I tell you there's other smells to diarrhea, this was not normal. And I'm going to be descriptive. It's because they're not breaking down the protein and some of the fat. And they get what's called steatorrhea, which is a very fatty diarrhea. But basically, the dog is pooping out its meal, and it's just passing right through. It's not digesting. So what the dog is passing is undigested kind of like chyme and foodstuffs. And what was happening is the reason the dog is starving, it's because the food is going right through. It's not digesting, so it's not absorbing protein, and it's not absorbing fat. So the dog, I literally could not put the food in this dog's run. He like jumped up and like hit the bowl and like knocked it. And he's like, Arr. I want to say like 5 minutes, everything was gone. There's a special fecal test. It's called a trypsin test. And I had to take it's like a little strip, and you have to take the stool and put it in a tube with this special like strip and look for like a reaction. But basically we diagnosed EPI. And there's a medication, and it's called there's a medication called Prozyme. There's maybe another kind, but we used Prozyme. And what Prozyme was is they would take the pancreas. I believe they got this from cattle pancreas, obviously after slaughter. But what they would do is they would harvest that, and they put into a live culture medication. It comes in like a big bottle. It's a powder, and it has to be refrigerated because it's kind of live enzymes. So what the owner would do is they would take the food and sprinkle it with this Prozyme, a certain amount, and it has to sit for a half an hour. Now, what happens is the Prozyme pre-digests the food because the dog is lacking the digestive enzymes. So the meal gets pre-digested. And then after a half hour, the dog eats. Well, sure enough, as soon as we start this food, or we put this medicine, and we also put the dog on a very low fat, low protein diet. So we wanted to decrease the protein, decrease the fat, and then that's going to help digestibility. So the dog was on a very strict diet, only certain treats, but the dog started gaining weight and having normal stool. And, like Morgan was saying, unfortunately, it's permanent. I mean, the dog can live a happy, healthy life. They are just going to have to stay on this medication, unfortunately. So it ended up, but, it's funny. I think the pancreas is important to understand, because in practice, you're definitely going to see animals, again, if they have an endocrine pancreatic disorder, the most common is diabetes mellitus. They're diabetic and they need insulin. If they're going to have an issue with their exocrine pancreas, they usually have EPI, which is exocrine pancreatic insufficiency. And there were very glaring clinical signs that point us in either direction, and understanding that the pancreas has an endocrine component and an exocrine component. And basically, either one, and I will tell you, if your brain, because sometimes it can lead you one way, a dog can have an issue with the exocrine pancreas and have no issues with insulin or glucagon. It's definitely not, they're not, they usually suffer from one or the other, not typically both. So, I mean, I can't say there's not a dog out there that has both, but for the most part, we usually would see one or the other. And you can't see it. Let me go back to the picture for a second. You can't see it in this picture, but the pancreatic duct, the exocrine pancreatic duct, it's going to empty into the duodenum somewhere at the beginning near this bile. This green one is the bile duct. It does not empty into the stomach, and that's sometimes people get confused. It's something that's secreted into the duodenum and not into the stomach. So are there any questions about the pancreas? Okay, let me just say a few things about the liver. I may stop here in a few slides because I kind of want you to process everything I've said. And the liver is considered a digestive gland. It's not within the GI tract, but what's not in this picture is the diaphragm would be right here. So it's very cranial in the abdomen. The liver lies right up against the diaphragm. And that's important. The stomach and the liver and the pancreas, that's kind of like digestion central. So everything is centrally located in that region for a reason. But it is a digestive gland, but the liver does like 5 million things. And I'm going to talk about other things that don't have to do with digestion. But slide number 69 here is very important because this talks about what are the jobs of the liver. Now, first of all, they are going to secrete substances that are going to help with digestion and absorption. Mainly what I'm going to talk about is bile, because the liver produces and secretes bile. So bile is needed for digestion, and that is produced by the liver. But the liver also synthesizes nutrients and regulates their release. If you remember, I just said all of the blood from the intestine has to come to the liver first, and it's going to process those nutrients. And it can release nutrients when needed. It can store nutrients when needed. So it's kind of like this filter, but its job is to process the nutrients, help release them when needed, help store them when needed. So it's very important in maintaining nutrients. It does also excrete toxic substances. Now, if you remember, when an animal eats, sometimes they're indiscriminate. They obviously eat food, but some dogs eat poop, some dogs eat dirt, grass. I mean, there can be a variety of wastes and toxic substances that somehow get consumed. And the problem is anything that is consumed is going to enter the bloodstream. And so by the blood going from the intestine to the liver first, the liver can process those toxins and excrete them. And the goal with a functioning liver is to make sure that those toxins get excreted and they don't get reabsorbed. Now, let me go backwards for a minute. I remember when I talked about my dog eating chocolate, and we talked about chocolate toxicity in class a little bit. You know, he ended up being fine, some diarrhea, but you know, he ate a bag of cookies. So when an animal ingests something like chocolate, onions, grapes, acetaminophen, cats with lilies, whatever, when they eat something toxic, number one, we try to induce vomiting if we can. And you usually need to do that within an hour and a half if we're going to be somewhat successful. So if we can catch them within an hour and a half of eating it, what we normally will do, we induce vomiting. And if it's been like an hour and a half, 2 hours or more, then we're going to assume what they've eaten is starting to be processed. And the problem is, what I said was, and hopefully everyone's following me and you're not bored to death, and just hopefully you follow me. Within chocolate, there's a chemical called theobromide, and that's what the animals cannot process. So what happens is theobromide will get absorbed into the bloodstream. Now, that blood, because the chocolate entered the intestines, the theobromide gets absorbed in the blood. It's obviously going to go to the liver. Now, what we worry about is when animals ingest a certain level. Now, my dog, luckily, and there wasn't, too much chocolate chips and he's big, the level that he probably ingested was manageable by the body. But if an animal ingests, the liver can only process so many toxins and get rid of it. So what happens is, even though that blood is going to the liver, some of that toxin is going to get reabsorbed in the blood, and that's when it causes the problems. But if we can catch them, I said sometimes we give them what's called activated charcoal. So, and it's a liquid. It's like this black, thick liquid. And when we give charcoal in the small, in the digestive tract, the goal is the theobromide, or the toxic substance, will bind to the charcoal and it stays in the stool and gets defecated, and it doesn't get absorbed. So that's the action of charcoal in that scenario, is if we can get an animal within an hour and a half and we can give charcoal, we hopefully get the binding. And then if it's bound inside the intestine to charcoal, then that toxic substance doesn't get absorbed in the blood. And that's our goal. But the liver will try to process any toxins and excrete them so they don't get reabsorbed in the blood. The challenge is what level of toxin. But again, if your dog eats grass, and grass sometimes has pesticides, I cannot talk, pesticides on the ground, chemicals on the ground, it's usually manageable amounts for the liver, hopefully doesn't reach toxic levels. The other thing that's really important, huge, and again, I'm lecturing in VTNE, so I'm doing all this review, is we've been talking about proteins and the role of protein. The liver produces proteins, albumins and globulins, but the protein is vital for fluid balance, drug distribution, osmotic pressure, helping repair tissue. I mean, a normal protein in an animal is key. Cholesterol is produced in the liver, and also the coagulation factors. That is huge, because anytime we have an animal that has liver dysfunction, or if they're going to have liver surgery, we always check their clotting profiles. Because if the liver is potentially damaged, then they will potentially have clotting disorders. And I can't remember if you guys, I think I was in anatomy with you when my sister's dog had heat stroke. I feel like it was your class that maybe my sister's dog, survived, but we were touch and go for 2 or 3 days. Uh, the liver enzymes were through the roof. So there was liver damage from the heat stroke. They ran clotting profiles and they were elevated. So they were very worried about my sister's dog having a brain bleed, a lung bleed. He had little bruising on his skin, which is sometimes when they get it's called petechia. And when we're worried about blood clotting, these dogs get like little micro bruises on their skin. He ended up getting a plasma transfusion, which helped replenish some of those clotting profiles, and he ended up healing. But anytime there's damage to the liver, we have to make sure that the blood can clot, because the liver produces these coagulation factors. Platelets come from the bone marrow. That's one aspect of clotting, but the clotting cascade or the coagulation cascade, and maybe you're doing this in ClinLab 1 now, you'll probably talk about that clotting coagulation cascade. There's many aspects to that. A dog can have normal platelets, but have problem with its liver and have problem with clotting. So, I'm going to skip a couple slides because I want to show you a picture first, because this is the picture that is going to be on the test. This picture on the left. And letter A is the dog and B is the cat. So hopefully everybody's still there. I only have 34 of you in here, but this is the picture that's going to be on the test that you have to label. So what we're looking at on this picture is, this is the liver. It does have lobes, not as many as there's lung lobes, but an animal can lose a liver lobe and still have enough functioning liver left. So there are kind of parts to the liver. And in the middle is this green balloon, and that's called the gallbladder. Now, remember when I told you the liver produces something called bile, and bile is a liquid, and bile digests fat. Very important to understand is the liver produces bile. The gallbladder stores and releases bile. So the liver does not excrete bile. The liver makes bile and it gets stored and excreted by the gallbladder. Now, that's the other thing we find on dissection. I'll say, I'll look at the liver and say, show me your gallbladder. It's kind of underneath and it looks like a little green kind of balloon, just like the urinary bladder. Our bladder stores and releases urine. The kidney makes urine. The bladder doesn't make urine. It just stores it and releases it. So this is similar, except bile is the fluid. Now, the gallbladder is going to have a bile duct, which is the tube. And the bile duct is going to connect to the duodenum. So when the gallbladder squeezes, it deposits bile into the duodenum, not the stomach. Now, some of you guys may have heard, oh, my dog's vomiting bile. Sometimes when dogs vomit on an empty stomach, but it actually comes up as a very yellowy orange fluid. Like sometimes dogs on an empty stomach, it's like a very, and it's really, now bile fluid is actually dark green. Sometimes a little bit of that bile can come up in the stomach and mix with stomach acid, and it comes up as a yellowy orange fluid. It doesn't come up as green fluid. So when they say an animal's vomiting bile, it's not the same consistency as the bile that's going into the intestine. It'll actually look like a yellowy orange kind of vomit. If you've ever, and I hate talking about vomiting, but if you've ever vomited a couple times in a row, and sometimes the second or third time, there's really not a lot there. It's just kind of a little bit of yellowy, it's a little bit of stomach acid and it's a little bit of bile, but it's kind of been mixed with stomach acid. And anywho, so we got the stomach here. This pink tube is the duodenum, and this kind of beigey yellow thing right here is the pancreas. And you can see that this bile duct looks like it kind of goes here and here, but I want you to know that bile does excrete into the duodenum. So you have duodenum, you have pancreas, gallbladder, liver. This thing over here, the spleen, it is attached to the edge of the stomach, except the spleen is really, it's an organ of the immune system, so it's not part of the digestive system, but it is in this picture. And then the left kidney is a urinary organ, but it's kind of right behind here. So this is just trying to give you an idea of what it looks like. Now, do you see there are 3 blood vessels? So the big red one is the aorta, which is bringing blood from the heart. And then you've got a light blue one is actually the vena cava. Then you've kind of got this purpley one. Now remember, this is the portal vein. So what's going to happen? Now, the aorta and the vena cava run parallel. One's taking blood to the abdomen. It's almost like 2 roads on a highway, right? You know, you're going one way and this one's coming this way, you know. So they're parallel. But this portal vein is bringing blood from where? Who remembers? Where is the portal vein coming from? So it's going into the liver from, where is the blood coming from that's entering the portal vein? The intestine. Okay, so down here, what's not in the picture, good job guys, the intestines are all down here. So all those venule, you know, it goes capillary, venule, portal vein, and then it's going to come into the liver, and then after the liver processes it, then it's going to join the vena cava. So if I was doing blood flow and I wanted to add the intestines, it would go like aorta, mesenteric artery, mesenteric arterial, mesenteric capillary, oxygen for CO2, then it would be mesenteric venule, mesenteric vein, portal vein, liver, vena cava. So if that gives you an idea that, and again, the thinking here is that blood from the intestines potentially has toxins, but it's also carrying a bunch of nutrients. The liver, it's like, hey, let me drop off my nutrients, and here's some stuff that's maybe toxic. The liver's like, okay, I'll process it. I'm going to keep the good stuff, which are the nutrients, and process. And then, oh, here's stuff we don't want. Here's wastes. Let me get rid of those. And then the blood that leaves the liver should be very clean and processed. And then it's got to go back and get oxygen. But it's kind of making like a little stop, a stop at the Brita filter. So for the interest of time, I kind of want you to just process that. I'm going to pick up with the liver and more stuff that happens in there tomorrow, because I could keep talking, but I want fresh brains for that because it's kind of important. Are there any questions?
I have one.
Sure.
So when the gallbladder gets inflamed, most times we remove it. So if that's the part that excretes the bile, then where does the bile come from? Or where is it stored once that's removed?
So what happens so they don't do this a lot in animals, but in people that do have their gallbladder removed, they almost get a constant secretion of bile. So the problem is, if you don't have a gallbladder, they usually tell you to not eat fat or not eat things that are high in fat. It's not that you don't have bile, because the liver is going to continue to produce it. You just can't concentrate it and secrete a large amount when needed. If you think about it, like the liver if it just keeps secreting like little bits of bile, the problem is the gallbladder, it'll concentrate it. And then when you eat a fatty meal, the gallbladder will constrict and excrete a large amount of bile to help digest. But if your liver is just constantly drip a little bit of bile, if you eat something fatty, it can't process it as well. So I do know, one of the girls, does that make sense?
Sure, because I know that I know that in some rare cases you do take the gallbladder out and animals, but it's very rare. So I wasn't sure if it, like, if there's a different way it stores or if it just secretes like that.
It'll just secrete. Duodenum, Morgan. So the gallbladder excretes bile into the duodenum, and that's where it digests. It helps digest mostly fat. Now, the problem is I've seen this surgery. It's called a cholecystotomy, or cholecystectomy, is where you take out the gallbladder. It's a very risky surgery in dogs. It doesn't always go very well. So it can be done. Yeah, if they have like a blockage, for some reason, they can have that and may have to have it. So it's not a very common, but they can have their gallbladder removed. And usually, like, and it's very easy in an animal to put them on a low fat diet. Like, they can't run up to McDonald's, or they can't run to, I mean, we can control their diet, and it's fairly simple. The problem in people is if you have that weak moment. One of the girls I used to work with, she had her gallbladder removed, and every once in a while she would cheat and go get a cheeseburger or fries, and she's just like, the abdominal pain that she would have, because she goes, man, she thought it was worth it at the time, and not very worth it, because the body just can't process the fat. You can get bloated and gassy and so yeah. And again, so if we're having issues like that in an animal, there are diets that they can be, I want to say, like the kennel diet that we use at school, which is the how we use it, is it the Royal Canin EN, or I want to say it's like a gastrointestinal diet. And gastrointestinal diets are typically low fat. Sometimes protein is lower, because those things are harder to digest. So normally we would probably just tell the owner, no fatty scraps, no, very strict diet. So are there any other questions?